Established in 1995, Care Alternatives is committed to delivering comprehensive hospice services with integrity and compassion. One of the first hospice companies to recognize the benefits of alternative therapies, such as massage and aromatherapy, its expert staff of trained healthcare professionals and caring volunteers embraces a holistic and personalized approach, caring for the whole person, mind, body, and spirit.
One of our key objectives and our primary objectives of our organization is education, and two, developing very meaningful relationships with our patients and families. In the field, we have numerous employees and professionals that spend most of their day educating both professionals and families and patients regarding the levels of hospice service.
The medical, emotional, and spiritual challenges of a life-limiting illness are often overwhelming for a patient and their family. For help, more and more Americans are embracing hospice, a comprehensive program of medical care that provides emotional and spiritual support to patients and families battling a disease or condition that can no longer be treated. According to the National Hospice and Palliative Care Organization and the National Association for Home Care and Hospice, 1.4 million people received end-of-life care from a hospice in 2007.
Hospice care is a comprehensive program of care that is delivered to patients and their families who are facing life-limiting illnesses. It focuses on treating the medical, spiritual, and emotional aspects that occur in the end of life. A hospice care can be delivered in the home, in a facility, or in a freestanding hospice. It is multidisciplinary care that is given by a team involving nurses, nurse managers, volunteers, physicians, social workers, and spiritual counselors. Palliative care is interdisciplinary care that focuses on the relief of symptoms, but it also can be combined with therapies that prolong life and can cure diseases. In hospice, the focus is entirely on palliative care.
A hospice and palliative care provider built on the belief that hospice should focus on quality at the end of life, Care Alternatives provides state-of-the-art hospice care, including pain control and symptom management through alternative and traditional therapies.
At Care Alternatives, we're committed to providing education to physicians, other healthcare professionals, patients, families, and the public in general about the benefits of hospice care. Our services include skilled nursing care, attention to pain and symptom management, home health aides, trained volunteers who can assist in a variety of creative ways. We have social workers, spiritual counselors, and we even offer alternative therapies such as massage therapy, reiki, aromatherapy, and pet therapy. We've seen wonderful results with our alternative therapies. In one case, with a dementia patient in a nursing home, when we administer aromatherapy, we're able to see the tremendous improvement in the patient's agitation, and the patients are calmer and seem happier, and it seems to help with pain control. In another instance, with a patient at home with lung cancer, a young man with a family, after massage therapy, he was able to relax enough to be able to open up to his family and really begin to pour his heart out about his true feelings. And it was really, we call that a hospice moment. It was quite beautiful.
Believing that hospice is about living life, another unique feature of Care Alternatives is its Dreamcatchers program, which makes a patient's final wish a reality through generous contributions from many families who were helped by hospice.
We have been able to help fly family members in to say their last goodbyes. We were able to let a pilot see his son fly a plane, which was his dying wish. And there are many other examples of wonderful fulfillments we've been able to grant.
On the day that my mother learned that she had terminal cancer, the doctor suggested that we look into the services of hospice. My mother chose Care Alternatives, and during the interview with Care Alternatives, she had mentioned a couple of her wishes to the social worker, and one was that she wanted to take her 9 children to the Waldorf Astoria to celebrate her 87th birthday in June. And a couple of days later, the social worker contacted my mother and told her about Dreamcatchers and that her dream could become a reality. And it was just a magnificent surprise to my mother and all of her children.
We're very gratified when we get letters and phone calls from patients' families who tell us how wonderful our care was. They particularly appreciate the fact that we might have broken some ground and used some different techniques to help to soothe their family members in their time of greatest need. At Care Alternatives, volunteers play a vital role. When we're caring for patients, especially in the home, there's all kinds of details that don't really fit into any kind of a box. And volunteers come into play when they help to problem solve for us, and our patients are most grateful to have them there to provide those services.
I'm a volunteer for Care Alternatives, doing Reiki in nursing homes with elderly hospice patients. I decided to do this when my father became ill. I gave my father Reiki and I saw the beneficial effects it had on him, and I wanted to do this for other people as well. And it calms them, it makes them more alert, it may ease their pain or help them to deal with it better. It just generally gives them a better sense of well-being. Spending time with them, sharing Reiki with them, has been a gift to me. It has taught me that this time in their life is nothing to be feared. It's part of life, and we should embrace it.
The level of care was absolutely the best, beyond even what we expected. And the loving care given to my mother by everyone through Care Alternatives was excellent. And they also supported all of us who also needed their help during this difficult time.
What we see in the future for Care Alternatives is to continue to provide the highest level of hospice care possible. We look forward to being on the cutting edge in the medical field, and as well as continuing with our alternative therapies. What I enjoy most about working at Care Alternatives and being the Senior Medical Director is being part of this amazing team of people who are working together with a single goal in mind, and that goal is to provide this wonderful end-of-life care.
Care Alternatives' many years of professional care, supported by national studies, demonstrates that early access, early prescription provides you with a higher quality of care of end-of-life services.
As our population continues to age, the need for end-of-life care will continue to grow. Learn more about Care Alternatives, Hospice for the Life We Live. For more information, call the number on your screen or log on to carealt.com.